Did you know that your skin can reveal secrets about your health that are hidden deep within your body? Yes, even signs of colon cancer. Today, we're diving into the unusual territory where dermatology meets oncology. We'll explore the weird signs on your skin that could be whispering warnings about colon cancer. From subtle changes to alarming signals, we're covering it all. Stick around to uncover these signs because recognizing them early could not only save your life, but also demystify how your skin is a window to your internal health. Acanthosis nigricans. Acanthosis nigricans manifests as dark, velvety patches, primarily in body folds and creases. This condition arises due to the production of insulin-like growth factors by tumor cells, which stimulate skin cell proliferation, leading to the characteristic patches. The presence of acanthosis nigricans is often linked with more advanced stages of colon cancer, serving as a critical visual cue for medical professionals to investigate further. The connection between acanthosis nigricans and internal malignancies, including colon cancer, has been substantiated by research published in reputable medical journals, highlighting its significance as an indicator of underlying disease. Tripe palms. Following acanthosis nigricans, tripe palms is another dermatological condition associated with colon cancer. It is characterized by the thickening of the skin on the palms, giving it a texture reminiscent of tripe, the stomach lining of various farm animals. The exact cause of tripe palms remains unknown, however, it is believed to be related to the production of growth factors by cancerous cells. This condition is not exclusive to colon cancer, but is seen in various internal cancers, making it a nonspecific yet important sign that warrants further investigation. The association between tripe palms and internal malignancies, including colon cancer, underscores the need for a comprehensive approach to diagnosis and treatment. Dermatomyositis. Dermatomyositis presents with muscle weakness and a distinctive skin rash, offering a more direct link to underlying systemic conditions, including cancer. It is an autoimmune reaction triggered by cancer, where the body's immune system inadvertently attacks its own tissues, causing the characteristic symptoms. Dermatomyositis can precede the diagnosis of colon cancer, acting as an early warning sign that may lead to timely detection and treatment. Studies published in the medical journals have explored the relationship between dermatomyositis and cancer, suggesting that the presence of this condition should prompt a thorough search for malignancies, including colon cancer. Pruritus. Pruritus, or severe itching, without an apparent cause, emerges as a noteworthy symptom. This condition is primarily attributed to the accumulation of bile acids in the bloodstream, a scenario often resulting from liver involvement. When colon cancer metastasizes to the liver, it can disrupt the liver's normal functioning, leading to an increase in bile acid levels. This, in turn, irritates the skin, causing persistent itching. The connection between pruritus and colon cancer, particularly with liver metastasis, underscores the importance of considering underlying malignancies in cases of unexplained itching. Studies, including those published in the Journal of Clinical Oncology, have highlighted pruritus as a potential marker for cancer, advocating for a thorough evaluation when this symptom is present. Hyperpigmentation. Hyperpigmentation, characterized by the darkening of the skin not confined to a specific area, represents another dermatological clue. This condition results from hormonal changes induced by the tumor. Certain types of colon cancer can produce hormones or hormone-like substances, leading to an imbalance that manifests as skin darkening. While less common, the occurrence of hyperpigmentation in individuals with colon cancer signifies the need for a comprehensive diagnostic approach. Research documented in The Lancet Oncology has explored the mechanisms behind tumor-induced hyperpigmentation, emphasizing its significance in the context of internal malignancies. Leser-Trelat sign. The Leser-Trelat sign, marked by the sudden appearance of multiple seborrheic keratoses, is among the rarest yet most specific skin manifestations linked to colon cancer. This phenomenon is believed to be triggered by the secretion of epidermal growth factor, EGF, or similar growth factors by the tumor, stimulating the rapid growth of these benign skin lesions. The Leser-Trelat sign is considered a paraneoplastic syndrome, a set of conditions that occur in cancer patients but are not directly related to the physical presence of cancerous cells. The New England Journal of Medicine has discussed the Lasserre-Trellat signs as a paraneoplastic phenomenon, highlighting its potential as an indicator of an underlying malignancy, including colon cancer. Sister Mary Joseph's nodule. Sister Mary Joseph's nodule is a distinct clinical entry characterized by a hard nodule in the umbilical region. This manifestation is a direct result of metastasis of cancer to the navel, serving as a palpable indicator of advanced disease. The occurrence of this nodule is particularly associated with gastrointestinal cancers, including colon cancer. Its presence signifies the spread of cancer beyond its original site, marking an advanced stage of the disease. The significance of Sister Mary Joseph's nodule in the context of colon cancer has been documented in medical literature, including studies published in journals such as the Journal of Gastrointestinal Oncology, highlighting its role as a prognostic marker in patients with advanced malignancies. Palmar erythema. Palmar erythema, a condition marked by the noticeable reddening of the palms, emerges as a subtle yet significant indicator that may point towards underlying health issues, including colon cancer. This dermatological sign is primarily the result of vascular changes within the body, often induced by cancerous growths. These changes can stem from a variety of factors, including alterations in blood flow or the tumor's secretion of cytokines, substances that can influence the behavior of cells and lead to the reddening of the skin on the palms. Despite its potential significance, palmar erythema is frequently overlooked in clinical settings, possibly due to its benign appearance or the lack of awareness regarding its association with more serious conditions. The link between palmar erythema and internal malignancies, such as colon cancer, has garnered attention in the medical community. Research has delved into how this condition can act as a nonspecific yet valuable clue to the presence of cancer. The mechanism behind palmar erythema involves complex interactions within the body's vascular system, influenced by the cancerous tumor's effects on the body's normal physiological processes. These effects can lead to the dilation of blood vessels in the palms, resulting in their characteristic red appearance. Studies have highlighted the diagnostic value of palmar erythema, especially when it appears alongside other symptoms suggestive of cancer. Its presence, particularly in individuals with no clear cause for such vascular changes, should prompt healthcare providers to consider the possibility of an underlying malignancy. This approach underscores the importance of a comprehensive evaluation in patients presenting with palmar erythema, as recognizing this sign can facilitate earlier detection and treatment of conditions like colon cancer. Pyoderma gangrenosum. Pyoderma gangrenosum is a rare, inflammatory skin disorder characterized by large, painful ulcers that often begin as small pustules on the skin. These lesions can rapidly expand, causing significant tissue damage and discomfort. The pathogenesis of PG is not fully understood, but it is believed to involve a dysfunctional immune response, wherein the immune system mistakenly targets the body's own cells, leading to severe inflammation and ulceration. This autoimmune-like reaction is indicative of an underlying systemic issue, which in some cases is a malignancy such as colon cancer. The association between pyoderma gangrenosum and colon cancer has been a subject of medical research, with the American Journal of Clinical Dermatology highlighting the condition's potential as a marker for gastrointestinal cancers. The occurrence of PG in patients with colon cancer suggests that the skin condition could be a manifestation of the body's reaction to the tumor. This link underscores the importance of considering a comprehensive diagnostic evaluation for cancer in patients presenting with pyoderma gangrenosum, especially when no other cause for the condition is apparent. Venous thromboembolism. Venous thromboembolism, on the other hand, involves the formation of blood clots in the deep veins, typically in the legs, which can lead to serious complications if the clots travel to the lungs, causing a pulmonary embolism. Cancer, including colon cancer, significantly increases the risk of developing VTE due to a state of hypercoagulability. Tumors can release substances that make the blood more prone to clotting, disrupting the balance between clot formation and dissolution. This increased clotting tendency not only poses a direct threat to the patient's health, but also serves as a potential early warning sign of cancer. Research published in the Journal of Thrombosis and Hemostasis has extensively documented the relationship between cancer and an elevated risk of venous thromboembolism. The findings suggest that unexplained VTE should trigger a search for hidden malignancies, as early detection of cancer can significantly improve the prognosis and treatment outcomes. This is particularly relevant for colon cancer, where early-stage detection can dramatically increase survival rates. We've journeyed through the skin to uncover the hidden signs of colon cancer, from the dark velvety patches of acanthosis nigricans to the unexpected blood clots signaling venous thromboembolism. Each sign is a crucial piece of the puzzle in understanding how our body communicates the presence of internal malignancies. And while these signs may be rare, their presence is a call to action, urging us to listen closely to what our body is trying to tell us. Because sometimes, the most silent symptoms speak the loudest truths about our health. Thank you for watching, and take care.